And we're live. Hey, people. Welcome to episode 252 of the Sports Therapy Association podcast. My name is Matt Phillips, creator of RunChatLive.com. And as always, this episode is being recorded live at 8 o'clock Tuesday on the Sports Therapy Association YouTube channel and Facebook page. Right then. So with this episode, we are going to start the countdown to the STA Southwest Conference, which is happening in Exmouth this September the 20th and 21st in collaboration with the ST School and Hands on Hub. And we're very excited about it. Obviously, not all of you are going to be able to make it there. And the idea is that we're going to start doing these kind of regionally so that you don't have to travel all the way across the country and find accommodation, maybe just trying to make it more accessible for everybody. But this particular one is going to be in Exmouth, in Devon in the UK. So if you can make it there, it'd be lovely to see you. So it's going to be an amazing weekend. I mean, I can tell you this, obviously I'm biased. I'll be emceeing the 2 days and I'm doing a presentation myself for people who work with runners. And we've got presentations, workshops and networking. So what we're doing over the next 4 weeks, starting tonight, is we're going to have some of the speakers as guests on the podcast. So you can hear from them, what they do, and a kind of little look at what they'll be delivering at the conference and what you can take away if you choose to attend their presentation or workshop. So we're going to start off very shortly with my special guest tonight. If you're watching this live and you can see on YouTube, my guests tonight are going to be Michelle Lyons, women's health physiotherapist and founder of Celebrate Muliebrity, and also Siobhan O'Donovan, aka the Booby Physio. I saw the word booby and it just threw me. But anyway, 𝐿𝐴 the Booby Physio and founder of Posture Fitting, both of who have been on the show before. So hopefully some of you will be already aware of these two great educators. But then next week, just to let you know what's coming up, it's going to be a Wednesday, not Tuesday, next Wednesday on September 3rd at 8 o'clock. My guests are going to be Dr. Claire Minshall, who a lot of listeners will be aware of, rehab and conditioning specialist and founder of Get Back to Sport, and also Serena Simmons, chartered psychologist and founder of the Psychology School, who's also going to be speaking, I'm thrilled to say, at the STA Southwest Conference and Hands on Hub Conference in September. Then the week after, we have the one and only Anna Maria Mazzieri herself, director of the ST School, who is going to be speaking obviously at the conference. She's going to be talking in a little bit more detail about the conference. And then finally, looking now at Tuesday the 16th, my guest is going to be speaker James Earls, again, who a lot of you are going to be aware of, writer, lecturer, bodyworker, and founder of Born to Move. And that'll take us all the way up to the actual conference on the weekend of September the 20th and 21st, which I should add includes an optional social event on the Saturday night. It's the weekend. That's one of the things when we sat around a large table throwing bits of paper in the center, we thought should happen. Let's have a weekend conference. Obviously, that doesn't make it easily accessible for everybody, but hopefully it will allow some of the people who can't attend other conferences, which are midweek, to actually make it there. You can't please all the people all the time, but hopefully we're reaching out. And as I say, these are going to be regional. So follow the ST School and the STA for details on where the next ones will be. So yeah, there's going to be an optional social event on the Saturday night with drinks and a buffet. And you'll see when you go to the tickets page that the option of joining us for that is on there. Go to the stschool.co.uk, click the education tab, and you'll see all the details there. And remember, if you are an STA member, then you can get a further discount as well. If you're listening this before the end of August, there is still a summer discount which can be applied, which you'll see on the webpage. But yeah, for any details at all, if you're not sure what's going on or whether you can get a discount, then email me, matt@thesta.co.uk, or email, go to the ST School and fill out the contact form there. Right then. So before I bring up Michelle Lyons and Siobhan O'Donovan, I must thank last week's guest, who was Megan Jackson. If you missed it, then obviously it's available as always on the Sports Therapy Association YouTube channel, or you can download it from any podcast app of your preference. Megan Jackson is our founder of Bodies by Merge, and she joined me to reflect. It's probably the last reflection we'll do for a while until after the conference, but she chose to reflect on past episode 224, Social Media, Do Soft Tissue Therapists Really Need It? Which was recorded back in January this year with guests Katie Bell and Daniel Lawrence. Megan shares on Instagram. I would recommend you follow Megan Jackson. I mean, it's a great episode. What I like about Megan is she's totally into touch, the power that can bring through massage and helping people relax and at ease, and all the stuff that comes with it, which we talked about on the show. Fortunately, now research is kind of supporting with regards to helping reduce anxiety and depression. And Anna Maria, when she's on, is doing some fantastic research into the power and touch. And we're starting to realize now we're putting some mechanisms of action into what we all know feels great, and how that can form a very important part of healthcare. So yeah, Megan does a fantastic job with that. I would encourage you to check out her stream on Instagram, which is Merge Massage Studio. That's MERJ Massage Studio. And she discusses on the podcast her personal journey into massage and how her marketing on Instagram provides about 80% of her clients, which is fantastic for her. It works. So she gives some great tips on creating quality content and leads, and also a really interesting section on how to prevent burnout, which is really important as well. So yeah, check it out. It's on YouTube if you want to watch the video, or you can find it on all popular podcast apps. Right then. Oh, I'm out of breath. Just shows after a summer break. I just haven't got it there anymore. Maybe it's just age. We're here. We're starting the countdown. It's all very exciting, and I'm absolutely thrilled to be joined now by two of the speakers from the conference: Michelle Lyons, women's health physiotherapist and founder of Celebrate Mobility, and Siobhan O'Donovan, aka the Booby Physio and founder of Posture Fitting. Let's bring them up. Oh, somebody say something. I'm out of breath. I haven't got it anymore.
Come on, get it together.
No, I can't. I can. I'm here.
You can. You can do this. You can do
How
this.
are you both? I'm just feeling so old these days. Thank you so
You
much.
definitely need to be in the middle then, so that we're surrounding you and embracing you.
You know, I can do that if you really want. Look, there you go. With this new system, does that show up at your end? Can you now see I'm in the middle?
That's amazing.
Look at that.
Fantastic.
This is one of the advantages of using what I didn't use before. Oh, now that's horrible. I don't know that at all. That feels like I'm at some kind of weird double date thing. Now I'm moving that back. The problem is you Siobhan, you described it as kind of a, what did you say? A rose between two shamrocks, which I thought is very clever, but I put myself in the middle there and I just felt like a thorn between two roses.
Oh,
sorry,
grown.
but that's what came to me.
Have you been practicing that, have you?
No, not at all. It just came into my mind. No, just came. That's what I see. I see what I see. Anyway, thank you so much for joining us. Really appreciate it.
Pleasure.
Giving up your time, and thank you so much for being speakers at this kind of inaugural conference. Really appreciate it.
I think it looks great. It's a really good lineup, first of all. So it's a pleasure to be a part of that. But I think there's something very special about getting together in person, because I think oftentimes it's the conversations that you have at the coffee breaks, or afterwards, or even at the dinner, that's where the gold can often lie as well. And the idea is that we'll trigger these conversations and dialogue with our presentations, hopefully, and spark a little bit of thought. But it's honestly, for me, it's the best part is the chats that you have with people, over a cup of tea afterwards, because I think you can find out what's actually meaningful and what other people are doing. And I never thought of it like that. And that's a really interesting perspective. And have you read this paper about it? So I love a good in-person conference. And I think this is shaping up to be a really special one.
And I think as well, the fact that you are going regional is really, really that's just so beneficial for people, because the UK is so big. I mean, I was over there at the weekend and I traveled 1,000,000 miles just between a couple of cities. And it is quite difficult for people to get to various different locations. Like the standard ones that conferences tend to be at make sense for Birmingham because it's the middle of the country. But then people have to travel from Scotland, so the fact that you're doing regional, I think it's really just embracing of the fact that people sometimes can't travel. And the Southwest, I mean, I've lived in the Southwest, so I know we used to travel down and we'd get to the A30 and we think we're nearly home. And then it was like another 2 hours. We were not nearly home because we were right down in Helston. So, you kind of, it is such a long way. So the fact that you're bringing it to the people, I think is really nice. Really, really impressive.
It's really important. We've really thought about our involvement in other conferences, and which are great. And we've thought about who are we not reaching? And we know that an awful lot, for example, of STA members can't make it to other conferences. So we thought, okay, how can let's bring it to them if we can? And
go to the people.
But it wouldn't be successful without speakers like yourself. And you, I know from listening to you and speaking to you, are going to provide exactly that, the stimulus to get people to chat and discuss and reflect. And that's what the whole conference is about. So I'm really pleased you guys are on board and coming over from Ireland, which we mustn't forget as well, flying over there, we really appreciate it. We are actually looking at bringing it to Ireland as well. So I'm really excited about that.
Oh, amazing.
No, we're we've got somebody over there who are looking at hosting. And so, yeah.
Cool.
Nikki Mansfield, what's Nikki said? Nikki says here, oh my God, it's Double Trouble of my favorite Irish physios. Is the bandwidth even wide enough for how awesome both of these women are? There you go. Thank you, Nikki, for summing up.
Thank you, Nikki.
We'll drop her a tenner later.
Yeah, exactly. Brilliant. Okay. Right. So I was just talking off air. I mean, I know you both. I've got the pleasure of knowing you both, and you've spoken at Therapy Expo, and you've been in the podcast a few times. But I always hope and pray that out of the couple of thousand downloads which we get, then that people don't know about you, because otherwise this is all a waste of time. We may as well just switch off the light. So for the people listening to the podcast, thank you very much, podcast downloaders. Maybe starting off with the Booby Physio, Siobhan O'Donovan. Could you let us know about yourself and how you got into doing what you do?
I certainly can. I just have to remind you that I'm the one from Cork, so I will be the one that needs to be stopped from talking. You should probably have started with Michelle, but anyway. Okay, so brief précis. Originally trained as a PE teacher because I wanted to be involved in the sports field. That was kind of the only route open to me to be involved in the sports field, really. And then having done that and a year of what sounds like penance in London teaching, it was actually great. I kind of had developed an interest in sports injuries at that point and kind of thought, ooh, what's this all about? Cut to the next level of education, went to the States, did a master's over there, did my professional certification over there as what's called a certified athletic trainer, which is a very sports specific qualification. Worked in an amazing orthopedic sports medicine clinic there, which was very much ahead of its time. They had everything on site. I remember seeing a student athlete in the morning for an assessment, and she had surgery that afternoon. It was that kind of a place. And it was in the middle of nowhere, like out in the middle of nowhere in upstate New York. It was amazing. And then came back to the UK and kind of, I suppose, and then from the UK to Ireland, and began to do, I think, a little bit more work outside of the sports field, but taking very much that background that I had gotten from the States, which was very preventive. So their focus over there has always, because of the way athletics are, and when I say athletics, I mean all sports as opposed to track and field, they're very much about having professionals on board to try and prevent the injuries from happening. And that was back in the 90s, when I think we were probably a little bit further behind over here with that kind of a thing. So I've always kind of carried that preventive focus with me, and then ended up just having more and more conversations with people about posture and about alignment and, you know, the concept of stacking and just how we function better when we are in that more stacked positioning. And then basically had an epiphany, totally out of the blue, with having a bra fitting done myself. Walked out of that place an inch taller than I went in, physically and psychologically. And then just put the two things together and kind of went, you know what, I need to get this to the people, because I just began to see something that I had never seen before. I had never looked at it. I was one of the people who had never considered it. I couldn't understand how I had never considered it, but it's not anywhere in any of our training. And, you know, I mean, I had trained in the US as well as over here, you know, so that's why I've kind of gone the route that I've gone, so serving patients, but also trying to get more therapists trained into that field so that there's more awareness all across the board.
I love the expression. Yeah. What did you say? Like a centimeter taller physically and mentally.
Yeah.
Give us a little bit of insight into people who can't understand, well, how did just changing your bra fitting kind of have those effects physically and mentally? So,
I mean, if you think about the logic of breast weight, it is a gravitational pull. Like we're constantly working against gravity, and we have to hold our bodies up against gravity, and women and girls have to hold up a heavier torso against gravity. It is basically that simple, and it's harder work. But we do it, and these breasts grow with us, so we don't particularly appreciate how heavy they are. When we actually look at the weight that women are carrying, it's pretty significant. It can be up to 4 kilograms for some women. It can be less than 1 kilogram, but the average at the moment is considered to be 750 grams per breast. So, you know, that's 1,500 grams. That's a fair old bit if you were carrying that around. That's like me having a Jack Russell across my chest all day. So walking around with the Jack Russell, that's the weight that my equivalent is a Jack Russell. I have different animals for different sizes.
This is a good analogy. No, that's great. It really kind of, because it's difficult to understand, isn't it? Even talking about grams, people don't appreciate it. But when you say that equivalent of a Jack Russell, it's perfect. And that makes you think, wow, I need to really think about how I'm holding that Jack Russell.
Absolutely. And to be honest, I mean, when I had my epiphany, it was in London, and I was going to the proms for the first time ever. And I've said since that I walked into the Royal Albert Hall, and if they had said, "Oh, our first violinist has been struck down by the flu. Does anybody know how to play the violin?" I'd have been like, "I don't, but I'll give it a go." I'd have gone up there, no bother. I honestly felt I could take on the world. I just had this, what I think we're now calling an empowerment, just a feeling that I was a taller, taking up more space in the world. I think I was just more present. Whereas previously, I wouldn't have known that I wasn't. I wouldn't have felt that I was walking around like this or anything like that. But I just suddenly felt I can do anything. I can do anything I want to be able to do. And that was really for me. And I know that physically, there are a lot of people that we can help physically with what we do. And at the time, because I was playing international rugby, I wouldn't have been physically in need. And that's why I think the psychological side of it hit me so, like, literally between the eyes, in terms of just the impact that it had on me. And then I started to do the research, because I was like, well, why have I reached this point in my life? I'm an international athlete. I am I'm a sports medicine professional. How have I reached this point? And nobody has ever talked to me about my boobs, not to mind say anybody else's. And that's when I started to do the research, and then mind absolutely boggled by what I've read and what I've seen. And then just picking up on the fact that it has such a social effect on people as well. So we've got the physical side, we've got the psychological side, and we've got a huge social impact side as well. So yeah, and that feeds in, they all feed into each other.
Amazing. So much in there. So much to do with 𝐒𝐓𝐻.
Isn't everything though, Matt, really?
Isn't everything, it's true. Tell us about 𝐒𝐓𝐻, Michelle.
Yeah. So, well, first of all, may I just congratulate you, because I think this is our 6th podcast interaction, and you nailed it. You nailed 𝐒𝐓𝐻 there. It was impressive.
That's a great word.
It's a great word.
So 𝐒𝐓𝐻 is the art and state of being a woman. And I think, Siobhan and I are probably fairly close to being on the same page with a lot of what we're talking about, in that, it's a cliche for a reason, but knowledge really is power. And that's why, I'm very excited to be given the chance to talk about one of my passion projects, which is better education around that intersection of hormonal health and musculoskeletal health. So I qualified as a physio over 30 years ago. And when I was going through my training, it was all hips are the same, all shoulders are the same, all knees are the same. And they were all basically based on the male as standard model. What we're learning now is that actually our hormonal health as women really has a huge effect on our musculoskeletal system as well. Whether we're talking about the younger nulliparous female athlete who's never given birth, or we're talking about the pregnant athlete or the mother athlete, and it was great to see so many mother athletes at the most recent Olympics, or even at the masters athlete level. And what I'm really kind of interested in is how can we educate women about their own bodies so they can start taking charge of this and tuning into their menstrual cycle really as a superpower that's going to give them good information. It's not a burden. It is actually a superpower, and the American College of Obs and Gynae actually recognize it now as the 5th vital sign. But when we're working with female athletes who are maybe having recurrent injuries, who are picking up all these bugs, who are losing focus, their performance is suffering, they're tired, but they're not sleeping, asking very pointed questions, and appropriate questions, might I just add as well. It's really appropriate whether you're a physio or a coach or a trainer, or any sort of bodywork therapist, that we ask these questions and we really normalize talking about the menstrual cycle, because women are not small men. We know that our female athletes have about 7 times the ACL injuries than their male equivalents. we're seeing an explosion in the research now about fueling and RED particularly. And I have to give a shout out to my colleagues at FIFA, because there's just been a couple of really exciting papers, I think, looking at pregnant and postnatal athletes and participating in football. It's a great time to be doing this, to be working in women's health. But you know what? As I said before, knowledge really is power. And it's to give those patients who are having these recurrent niggles just the power to say, well, could it be overtraining? Or could it be actually the early signs of low energy availability? Could it be heavy menstrual bleeding, maybe driving a little bit of iron deficiency and somebody's on the path to anemia? Or if they've lost their cycle altogether, So those are kind of the things we'll be talking about. Either it hurts, there's too much of it, or the menstrual cycle's gone away. And they each have their own kind of patterns of dysfunction that I think, as people working closely with female athletes, we need to be able to spot. So it's about pattern recognition, and then what can we do to help them get it back and to help them live better and perform better.
Fantastic. Siobhan, you're nodding away there. Would you like to add something to it? Or?
I quote Michelle all the time. I think one of her most, if this is your legacy, I mean, you've a huge legacy, but I have to say, the word research, I just think is the best word. I mean, she's brilliant at wordplay, clearly, with the 𝐸 as well. And it's not wordplay, but like discovering these words. Like, I didn't know what that word was. I love it. But I just think the concept of research is so vital, and I think it's also a really interesting thing to see that happening now, with people being so much more comfortable with that concept of learning a little bit more about themselves and also advocating for themselves. And at the moment we're getting in, which is absolutely lovely, we're getting in quite a lot of mother-daughter consults, so they're coming in together, which is brilliant. And I actually had a situation where the mom was expecting the daughter to be embarrassed, and the daughter was not the embarrassed one. The mom was kind of like, "Oh, are you okay with this?" And she was like, "Mom, yeah, I'm fine.
Yeah.
This is normal." And it was interesting, really, because mom would have been in her maybe 40s, so the generation where we were less inclined to discuss things, or we were less inclined to talk about things, or you've got some of those taboo in my world, kind of words and concepts and topics. And I think the likes of Michelle having kind of really pioneered so much of this women's health field. Well, I mean, look, I do think there's a bit of a Irish pelvic health mafia, because I remember when I first got into the women's health field, I was like, gosh, and that's another Irish person who's doing amazing things, and another Irish person. So I don't know how that's happened, but we have. So there's a lot of shamrocks, Matt.
There's an awful lot of shamrocks. And long may they reign. It's good work. What I love, I mean, the reason I just say, what do you want to say? Because I could listen to you forever. It's wonderful. But one of the things I really love about what both of you do, and a lot of my guests, is hopefully what listeners can get out of just these tiny little tweaks with their patients, just asking simple questions, just getting to think about something which they hadn't thought about before, or probably haven't thought about before, can make a huge difference to not just performance, but pain, lower back pain, psychological motivation, desire, on a huge kind of scale. And this is so empowering, and it's really empowering for massage therapists, because we've kind of discussed before, massage therapists, and this is you, the listener, if you're a massage therapist, are probably the first point of contact for a lot of people who need to hear the kind of information which you two so wonderfully give, because they're probably coming in because they're fed up, in pain, lower back pain, shoulder pain, neck pain, and some of the factors which they're not considering is the sort of stuff which both of you kind of educate therapists. So do you find that with massage therapists? Is there so much they could learn?
I do, and I find, like, I'm all about multidisciplinary collaboration, because I think that's the way forward. That's how we serve our patients or our clients better, is talking to each other, because we're all sailing in the same direction. But it's again, like, just to kind of return to that theme of, it is different for your female clients versus your male clients. Let's say, again, with back pain as your example. So if you've got somebody who's dealing with recurrent back pain, yes, of course you're going to screen them for red flags, but make sure that you're adding in some female specific factors there, not just the menstrual cycle, but also, are they having any difficulty? Are they having any bladder leakage? Are they having any difficulty having a bowel movement every day? Because those can be signs of overactivity in the pelvic floor. And we have lots of studies showing that for women with back pain, dysfunction in the pelvic floor, which can often manifest as either bladder leakage or constipation or pain with sex, all of these things are more strongly female-centric drivers of low back pain. So we need to be screening those out. We also need to look at stress as a driver of female-centric back pain. We've lots of good studies looking at that, but also breath work. So it's about, yes, zooming in on the problem in front of you, but also then remembering there is a whole person attached to that spine, to that pelvis, and taking their story, because we are actually at a little bit of a crisis point about keeping girls and women in sport and physical activity. The numbers of girls and women in the UK particularly, I just was looking at some research. It's about 30% of females in the UK are meeting the recommended daily activity levels, so 120 minutes a week and 2 strength training sessions. And we need to make sure things like inadequate breast support, bladder leakage, period pain or period concerns, we need to make sure that these are not barriers to participating in physical activity in sport, because if you are not laying down your optimal bone strength by the time you're in your early 20s, that ship has kind of sailed.
Yeah.
If you're not setting up good patterns of physical activity where you're enjoying it, I mean, we know that it's so important for our mental health throughout the lifespan. We now know that physical activity can be as effective as medication or talk therapy when it comes to managing depression and anxiety. We know that the social cohesion that it provides, but also most women who end up in C-suites will have participated, like Siobhan, at sport at a high level as well. So the ripples are enormous when it comes to, and I said ripples, Siobhan, just for clarity, because I know where your mind went. It's just so important on a societal, on a psychosocial level, as well as on a biological level, that we look at these clearly identifiable barriers to not only getting in sport but staying in sport, and we need to play our part in making sure that we're educating girls and women to live their best lives.
And I think just to reinforce that as well, Matt, some of the removals of those barriers are so simple that they've actually been overlooked. Yeah. And I mean, I very much find that with the work that I'm doing is that, we have research showing that the poorly controlled breast movement is one of the reasons why teenagers drop out of sport. So we can sort that out. We can very easily sort that out by giving them not just a sports bra, because that's not good enough. The conversation does not need to be about sports bras. The conversation needs to be about optimally fitting sports bras, because there's no point in putting on a sports bra that doesn't fit well, because you may as well just not have bothered. So it's about the education behind that. And even with the likes of, some of the issues with periods, and I can remember this happening actually with a girl that I played with, like the Irish girls now are wearing navy shorts. They're not wearing white shorts anymore, and that's a huge step. And that's like, given everything else that's gone on over here with the camogie, the fact that they said that they wanted to do that was passed. It's kind of like almost a breath of fresh air that it was almost allowed without there being a big fuss and a big hoo-ha about it. I think the England girls have chosen to stay in white because white is their, because that is their colour. But I think it's going to be interesting to see if there's a difference even in terms of some of the international selection situations, that there may be some girls who may be lost to some of the sports that are still wearing white shorts, as opposed to, just having that. It's about being in a safe space. Yeah. And when you're playing your sport, you want to be fully safe and fully considering what you're out there for. So you want to be thinking about the ball. You want to be thinking about your opposition. You want to be thinking about getting down the track before the other people in the lanes next to you. We did some work with a football squad, and one of the girls, she was 14, and she came out with this herself. Like, this wasn't prompted at all. And she said she throws the ball in from the sideline, and that she would literally throw the ball in and then have to adjust her bra because it would have moved. So she'd be back running on the pitch, spending, what's that, a nanosecond sorting herself out instead of following the ball that she's just thrown in. and stuff like that. And she recognized that, and she was 14.
It's a distraction, isn't it? It's just, we don't want girls distracted by
Exactly.
these very easily modifiable confounding factors. Because if you're thinking about your bra, if you're thinking about, did I start my period, you're not thinking about the game.
Exactly. And you've got to be on a level playing field, literally, in terms of you have the same level of concentration as everybody else on the field. There should be no reason why you don't have. And like Michelle said, they're so modifiable. Now, there are other situations that are a bit more complicated. But I think one of the things that we've done as a healthcare profession, and I would say this, kind of across all the disciplines, is that sometimes we forget the simple solutions because we are busy looking for the complex ones. And sometimes it's right in front of our eyes. And we just need to take a step back and review things, reframe it,
Great examples. And there's so much in there on a therapist level, just especially, for example, with younger athletes, for example, if the parents are saying, oh, she doesn't like playing anymore, you find out they don't like playing anymore. And you can ask them simple little questions just to see, like, what color kit do you wear or something like that. And you can change their life. You could maybe,
quite literally.
Quite literally.
Yeah.
And you can
it is
contact schools. I imagine quite a lot of schools still automatically go for white gym kit. It's still probably present in an awful lot of schools. And it's not because they're trying to be nasty. It's just because it's tradition and no one's actually said to them,
nobody's actually stopped and thought about it. And it is that longer impact. It's not just about keeping them in sport right now. It's where that takes them in their 20s, in their 30s, in their 50s, in their 60s. So it is a lifetime potential influence, at a very impressionable age. Very simple.
We see it with I used to do the warm-ups for the Brighton Marathon, and you'd have the younger runners doing shorter distances, and up to kind of like 11 and 12 girls who were taller anyway and just looked more mature and just together with it. The boys at that age were kind of dribbling and still trying to do out the shoelaces. The girls looked great and they were just elite. They were just like gazelles. And then suddenly like the over 13s came along and you just went, where have all the girls gone? What's happened? Suddenly it's all guys. It was so sad. You're thinking, what are the factors for that? And everyone blames kind of Instagram, and kind of like,
I don't know. It was happening long before Instagram, to be honest. And I just think, yes, I mean, that's another layer, I think, of social pressure that we're putting girls, and let's be fair, boys, but we're going to keep it female centric for now. But I think it's just, as Siobhan will tell you, like if you are not well supported from a breast perspective, if you're worried about leaking, if you're worried about getting your period and about it showing, there's a lot of peer pressure at that age from the social perspective. You don't want to stand out. You want to be just like everybody else. And it can be a very intimidating space to be in. But I think I actually think the benefit of things like Instagram and TikTok now is what I'm seeing now when I go out and I talk to girls, different sports clubs. This whole generation now of 13 and 14-year-olds are far more matter of fact about it than even 5 or 6 years ago.
Yeah.
And it's like, well, it's just, if I strain my calf, I'd be talking to you about that. So I'm going to talk to you about this just as easily. And it's so refreshing to see that, and to see that confidence as well as body literacy emerging. I mean, we've a lot of work still to do, but it's the attitude around it is changing. And I think it's because we're seeing a lot more exposure to women's sports, particularly with the Rugby World Cup that's going on at the minute, with FIFA, with the work that they're doing it. But we're seeing it, I think, in almost every sport, whether it's athletics or golf or swimming. It's across the board. Women's sport is definitely having a moment. And now that we have role models that we can see achieving these, you can't, what's the saying? You can't be what you can't see. We now see strong, powerful women achieving and getting their plaudits for it and getting their financial rewards as well. So instead of aspiring to be a wag, now you want to actually be the athlete.
Yeah, absolutely. That's really true. And I mean, I think the other thing is it's getting younger and younger. So like when the dropout rate used to be kind of 15, 16, and now it's down to the 12s and the 13s, and it's down to, it is, and again, their social situation is different as 11 and 12-year-olds and 14-year-olds now than it was 20, even, 10, 20 years ago. So certainly they've got a lot more peer pressure, and there's a lot more distractions, I guess, as well for them. So for us to be able to make it a simple situation for them to stay in that activity is also really important. And I think there's also a huge appetite for learning. Like, these girls want to learn. They want to know how to be better athletes, how to be better players, how to, they're and not even because they're aspiring to be at a high level, just simply because they're interested. Like, I've gone into schools and expected there to be a lot of giggling and sniggling, and there wasn't. They were all really engaged, and and again, not in any way embarrassed, in the way that I think 10, 15 years ago there would have been a lot more of that going on.
That's good. That's encouraging to hear. That's optimism. That's nice, rather than complaining about the modern generation. And it's actually, there's potential there, as long as the adults around them kind of wise up and change their attitudes as well. That's good. I really like that. You can't be what you can't see. That's amazing. And also, instead of aspiring to be a wag, that's great.
That's great.
Very cool.
But when I was playing club rugby, we had, and so we were reminiscing over the weekend about this, we didn't have spectators, so we couldn't get sponsors. And because we didn't get sponsors, we didn't get the media. And because we didn't get the media, we didn't get the spectators. And because we didn't get the spectators, we didn't get the sponsors. So, it really has just turned that corner where all of those things have started to feed into each other. And so that visibility has absolutely exploded. And it's just so lovely to go to the games. And I'm talking about all the games that I've been to, not necessarily only rugby, but just to see the number of kids down at the the fences afterwards, waiting for autographs. And it's not just girls at the women's sports games, it's girls and boys. And I think that's really important. I was really disappointed with the Lions, the last Lions game, the men's game. They brought the players out, and all the players had, the young players with them, which is a brilliant opportunity for those young players, but it was all boys. And it was like, why have we not brought out some girls? Surely there's some girls in Sydney. And then the next Irish women's game that I was, just happened to be an Ireland-Scotland game, and they all had boys and girls with them. And it was like, why are we thinking about that in women's sport, and the men's sport didn't consider that to be important enough? So I had a bit of a moan at the Lions.
Oh, well deserved. Yeah, that's great. It is the little things, like you started off saying, so little things can make massive differences. Fantastic. Gary Benson has said, confirmed, good evening all. Hopefully we would like to come across to Ireland in the autumn 26 or early spring 27. I'll be speaking to our regional reps next month, which is fantastic.
Exciting.
And Cecily Hislop says, having recently started a couch to 5K thing and joined the FB group, the topic of sports bras is a big thing. You've just reminded me, actually, Siobhan, you mentioned kind of it's not about getting a sports bra, it's getting a well-fitted sports bra. Can you give me one example of where maybe women or young girls are going wrong with sports bras? What is a badly fitting? What's the most common mistake people make?
Well, the most common mistake made is not wearing one at all.
Right.
That's the starting point. And then when people, and again, this is, coming through social media or coming through Facebook groups or coming through conversations with people, when somebody says, oh, I need to go and get a sports bra, or I am going to, kind of maybe take this activity a little bit more seriously, or going to do it more often, then there is okay, what do I do? Where do I go? There are now 1 million sports bras on the market. I mean, it has exploded. And I think it's very challenging for somebody. I would have found it when I was, when I was young and playing. And if I was now going, okay, I need to get a sports bra, where do I start? I think it's really difficult, unless, again, you have done your research and you have learned how to look after yourself. And that's where I think very much we're all about educating people to be able to fit themselves. So there are criteria of best fit, which have been done through some of the research studies, the papers that have been done, mostly out of the University of Portsmouth, but some also out of Australia as well. So you can go online and you can Google criteria of best fit, and you can find out what they are for a daywear bra and for a sports bra. But basically, the key thing for a sports bra is it's a higher level of engineering, because it is expecting you to be moving. And what we know is that breasts move in 3 planes. So they don't just move up and down, down, which is what everybody thinks, and everybody just thinks it's up and down and bounces this way. But we move in and out, and we move anterior, posterior. So it's actually a figure of 8. And so when you're getting a good sports bra, you want that sports bra to be considering all of those activities. So when we walk, there's about 33% in each direction of those planes of movement. When we run, the vertical component does go up to 50%. So that's where that focus has gone onto it. But you're still talking 27% of the AP and 22% medial lateral. So we still want to be supporting that. And again, one of the things that's happened is that there's this concept of, that'll be fine, they'll be grand.
Right, yeah.
Strap them down and we'll be grand. And that is not the answer, because we don't know what that's doing. At the moment, we don't have research long-term showing if that's damaging to breast tissue, but you can't imagine it's great for it to just be kind of compressing the breasts, because you're also spreading them around here across the body, which is the opposite to what we're doing with a well-fitting daywear bra. And also then from a gravitational perspective, but also it's what it's doing to breathing. If somebody is in the default with a sports bra is that somebody will buy something too small, which is the opposite to a daywear bra. And particularly if they go and get fitted in somewhere using an old technique, which is unfortunately still out there. We see a lot of women in daywear bras that are too big in the band, and therefore they're too small in the cup. But in sports bras, we see the opposite a lot, where somebody has just gone for a smaller band and probably a smaller cup if it has a cup at all. And these ones that go over your head and, are all kind of just about clinging and keeping everything, again, kind of strapped down. But if that doesn't allow somebody to expand their rib cage, then their breathing mechanics are being affected. So there they are out there doing their best to do their activity, and they're not doing their activity as well as they could do. And that has impact on their performance, but it also has impact on their pelvic floor.
Yep.
And it has impact on their musculoskeletal health, because then they'll start running like this. Or if they're poorly supported and they're still not supported in the other planes, they'll be running like this. And we see this, like you'll see people running along the street. And I always think, firstly, fair dues to you, you're out there running and well done, or maybe walking fast or whatever. But if somebody is doing this and holding themselves, then their whole running style is completely and utterly being affected by inappropriate muscular activity. So that's affecting performance, but it's affecting pain. It's affecting their willingness probably to continue participation. So they just won't enjoy it and they'll stop. Not to mention potentially leaking.
Yeah, I think particularly, just to build on that point, with our postnatal women especially, because if they're breastfeeding and they're trying to get back into exercise, they're potentially having some pelvic floor issues. There might be a little bit of diastasis concern going on. They've maybe lost a little bit of thoracic rotation anyway, because the rib cage can go up and out about 4 centimeters towards the end of pregnancy, and it doesn't necessarily come back down by itself. So you put all of that together, and now instead of being able to rotate around the running gait, they're going up and down more. So now they've got more of a ground reaction force to deal with. And their shoe size has probably gone up during pregnancy as well. And maybe they're wearing a slightly ill-fitting shoe, which means that their foot and ankle aren't absorbing that ground reaction force as well. And that's going to come out through the pelvic floor. So we stop exercising, because it doesn't feel good and it's making us, leak. It's very uncomfortable. We're starting to pick up niggles. And that could literally be the end of somebody's journey with exercise and physical activity, because it's a busy enough time anyway. And what we're seeing is not only are they then losing out on the physical health benefits of that, but the mental health benefits of exercising postnatally it's just the research around this is really, really interesting. The benefits of ideally being able to leave the baby at home well cared for, and you going out on your own to exercise has been shown to be remarkably supportive of postnatal mental health. And so anything we can do to facilitate that, we have to look at. So whether we're talking about, obviously a well-fitting bra that's appropriate for the task at hand, but also maybe some compression shorts, making sure that we've got good foot ankle mobility and strength, we've got a properly fitting shoe, we're maybe wearing some compression shorts to elevate that bladder neck. and she's able to enjoy it and get back into her body again, because, for the past 9 months, she's literally been, carrying a passenger. And I think it's a really important kind of re-entry phase into normality that's often overlooked. And the mental health burden of that is quite significant.
And in turn, that's going to affect the children.
Oh, yeah.
Because if the kids are seeing mom and dad or dad out there enjoying activity, then the kids are more likely to be active.
Yeah.
But whereas when you get that woman who has kind of just gone, oh, it's just too much hassle, I just can't be dealing with this, and has chosen to go down the road of, oh, I'll do it later, I'll do it when they're older, I'll do it when they are in school, I'll do it when they are in college, and it never happens, because it's so much harder to get back into it once you've fallen off the wagon. Like it is more challenging. And particularly then, again, Michelle has some wonderful phrases. And the other thing that I always hear her saying in my head is about how exercise at menopause is a non-negotiable, and just how vitally important that is. But it's really hard to start at menopause, because there's so much other crap going on. And to try then and carve out that time for yourself, and to have the energy to find an activity that you enjoy, because there's all sorts of things going on with people's kind of confidence levels and their their willingness again to go out and to be social, or even down to driving anxiety, not wanting to drive somewhere. There's so many, again, more barriers being placed in the way. So if we can create that environment from the get-go where the teenagers are happy to continue, and they miss it if they don't,
and they prioritize it though as well, Siobhan, that it is a non-negotiable at that age for them, that this is just, it's a core part of their identity, and then they can keep that the whole way through. So we want to get them there, and we want to keep them there the whole way through for the rest of their lives.
Yeah, and then it is about, there will be different barriers. So what can we do to remove those barriers along the way? Even to things as simple as, I was in a health club in the UK yesterday, and they had playpens in the changing rooms. Now, I hadn't seen that before. I mean, maybe they have them in all the gyms nowadays, I don't know. But literally, as I was there, a woman walked in with her baby, put the baby into the playpen, got herself changed. She didn't have to be trying to hold the baby while she was getting changed. Tiny, simple things like that just make it an easier thing to do.
That's very cool.
How do we get to that?
I'm just hearing so many. It's so exciting. I'm hoping that listeners are realizing, sitting there thinking, oh my God, there's so many more ways I can help my clients. There's so many more ways. And I'm hoping the guys are thinking, I could become an expert in helping female clients here. I could be the only guy in the block who's actually thinking of these things and
who's asking these questions.
Because you don't have to be, you don't have to be a female therapist to talk about all of this at all. Just because you haven't experienced it doesn't mean you can't mention it. That's not what empathy is about. It's just showing understanding and listening and giving some advice. So very empowering.
Interesting, and like Michelle said, like, it's really important that we have this multidisciplinary kind of environment where people are I've always wanted somebody else to do deep tissue massage for me, because I've always known that there's a limit to how much my hands can do because of everything else I was doing. So I've always been in that kind of interdisciplinary environment, and that was very much from the clinic that I mentioned that I worked at in the States. So I think that's a really important situation, because also, when somebody is having a deep tissue massage done, they are probably having conversations that we might not have time to have, because we might be focusing on something that doesn't allow that level of interaction or that level of conversation, or we might be doing something that does allow a different level of conversation. So it's just about all of those situations are all going to be potentially beneficial from an interaction perspective. And how can we then all feed into each other with that? I mean, it's just communicating, isn't it?
It is, but it's bringing another level of depth to the conversation that shows your client or your patient that you get it, that you understand there's a little bit more nuance than just kind of rubbing out a trigger point, or telling them that you're breaking up adhesions, and kind of like using terminology from the dim and distant past. It actually shows that you see them as a person, but you recognize their specific needs and their issues. And if it's outside your zone of genius, you say, well, look, I have a colleague who I know is great at this, it might be a good idea to go talk to her about getting a good sports bra fitting done. I think that would really help with your thoracic, with your scapular, with your shoulder pain. Or, I have a really good pelvic floor physio that I can go see. And similarly, I can say, well, look, I have a personal trainer I can refer to who's fantastic with postnatal rehab.
Yeah.
I have any sort of body worker, like, massage is magic, just to be able to lie there and have somebody kind of, there's a reason that we've been doing this for thousands of years to each other when we're scared or when we're injured or we're sore, because it connects to us on a very deep level where it's not just about the issues in the tissues. It's about having that little bit of connection as well. So it's all of the above, plus, again, just recognizing those extra factors that could actually make the difference in getting your athlete, let's say, back into performing at their top level instead of just kind of chasing hamsters everywhere.
Yeah.
Brilliant. Amazing. So much in there. I don't think we need to talk about the conference now. I mean, if you want to hear more from these two, come along to Exmouth on the 20th. I mean, it's a no-brainer now, but we will.
I'm just going to need a deep tissue massage because I am nodding my head.
Nodding away like that. Yeah. No, fantastic. But we will. For people who have joined in and are interested in the conference. So I've just brought up on the screen, for those of you who are watching YouTube, this is Michelle's presentation. So the menstrual detective, why the fifth vital sign might be the missing link in MSK health for female athletes. And that is going to be on, just check, I can't actually see there we go. Saturday, September the 20th in the main theatre, because we've got two rooms. We've got a main theatre and we've got a breakout room for workshops and more practical stuff, at 3:55 on the Saturday, which hopefully, fingers crossed, gives Michelle time to arrive from Ireland. So that's why it's placed there. But yeah, so tell us, Michelle, why is Michelle not in there? Let's put Michelle in there now and sort that out. Actually, let me go to the next one first of all. We'll bring Michelle back in a sec. Siobhan O'Donovan is going to be Bits and Boobs and Bumps and Babies, which is going to be on the Sunday, September the 21st in the main theatre, 9 o'clock to 9:40. The title kind of gives away a little bit, but Siobhan, what do people who attend that, why would you recommend that they attend that? What are they going to walk away with without giving too much of it away?
Yeah, so it's really just looking at that biopsychosocial impact of breast weight, but also looking at it at I suppose, across different phases of our lives, but also different systems. So we're going to be looking a little bit at pelvic health, keeping in mind that Michelle will have spoken the day before. So just kind of, not obviously reinventing the wheel, but just looking at how pelvic health is affected by breast weight. And then looking at how, again, very much the focus being on breast weight during these phases. What happens to the breast during pregnancy, what happens to the breasts during the postpartum phases, and again, just kind of as we talked about a little bit already, just trying to help people to navigate those phases so that they can then get back into their activity level.
Fantastic. Amazing. And the wealth of it. And like we say, these presentations, it's not going to be a case of people just staring at you for 40 minutes listening and trying to write everything down. That they're gone are those days where if you see the STA involved in something and the ST school, no, you're all going to be around, because I know, because I'm kind of planning it, but there's going to be round tables with notepads in the middle, and the speakers are going to be interacting, asking you to kind of come up with ideas, very interactive, so that we really do kind of present the learning circle as it's supposed to be. So exciting. We won't give any more away than that. Oh, will we?
Can I just say I'm going to have two lovely assistants with me.
Oh, it's true. Ooh. Shout out to them. Tell me who they are.
So Kate Wilsmore, who is based in Plymouth, and Helena Kostiff, who is a pelvic health physio, who is, she's going to be there on Sunday. Michelle, she can't make Saturday, unfortunately. So because Helena is a pelvic health physio, and she's going to kind of go into that side of things a little bit more. And Kate has actually just recently experienced the bumps and babies bit herself. So I'm just kind of bringing them in for their own zones of genius. Do love that as well.
Fantastic. Superb. Sorry, Michelle, I lost you there for a moment. It's my fault, technical thing. But yeah, let's go back to, Michelle. So you're going to be there Saturday, September the 20th in the main theatre, 3:55 p.m. with the menstrual detective, why the fifth vital sign might be the missing link in MSK health for female athletes.
Exactly. So I'm going to be talking about, basically what we need to know working with people in the musculoskeletal zone. What is the influence, first of all, of the menstrual cycle? What are the questions we need to ask? And what are some of the red flags we need to be aware of? Whether it's, again, as we talked about, like iron deficiency or anemia, because that can lead to recurrent injuries. But certainly kind of spotting the signs of things like reds before they become disasters. And oftentimes bladder leakage is actually one of the first signs, along with the missing periods of reds. So we want to be able to kind of spot those things before they get to the point of bone stress injuries or worse. So it's just understanding the menstrual cycle, how it's going to affect muscles, tendons, joints, and of course bone health. And really empowering therapists to ask the questions, but then to also know what to do with the answers.
Fantastic. Really cool. And for male therapists and female therapists, obviously.
Oh, absolutely. Gosh, yes, definitely.
Fantastic.
Everybody.
And then both of you are going to be involved as well in the 𝐬𝐭𝐻 collective panel, which is on the Sunday at 9:45 in the morning in the main theatre. And that's where, also being on the show, Ginty Sheeran and Lou Hawkins-Thompson, who are the hosts of the 𝐬𝐭𝐻 collective Spill the Tea podcast, are going to be joined by Michelle and Siobhan for a panel that's going to explore the language bias and cultural taboos that shape women's health experiences and how clinicians can play a pivotal role in reframing these narratives. That's going to be awesome having you all together on one panel. Whether we can keep it to 45 minutes. I'm looking at that. That should really just.
You sound nervous already.
That's just ridiculous. I don't know who planned that. Anyway, so fantastic. We're looking forward to those. Brilliant. Right, time is rushing on, but just to remind you that if you're listening to this, if you're watching live, or if you listen to the podcast before the end of August, then there is a summer discount for this conference, 20th and 21st in Exmouth in Devon in the UK. And if you're an STA member, then make sure you look out for the STA discount where you can get even more off. And if you're looking for the cheapest price, then join the STA, because honestly, with the price it costs, then you'll save on the ticket by doing that. And just to remind you, if you are interested in becoming an STA member, then use the code podcast25. Not because I get anything out of it. It's not one of those kind of codes. It's just simply because we like to track how people hear about the STA. So if you use that code, you get 3 months extra for free if you join for a single year. And it costs £75. We don't hide our prices. It's £75 a year. And use the podcast 25 and you'll get 15 months instead of 12. Only valid for new members. Right then. Look at that, 8:59. Fantastic.
That's precision podcasting.
Told you I'd manage it, my two roses. Not a problem at all. Not a problem at all. Thank you so much. I mean, I can't wait to listen back to everything you've said. I couldn't take it all in. That'd be impossible. I'd be superhuman. But you came up with so much great information, which, as always, it's just so empowering. There's so much in there which empowers the clinician, which is what it's all about. Because if the clinicians are empowered, then they can say all of this and have the confidence to help their clients and patients, which obviously is what it's all about. So thank you so much. I expected no less, but it's amazing. I'm hoping the listeners have got out of it as much as I have. So thank you.
Always a pleasure.
Yes, likewise.
And we're going to see each other. They're not that long away, isn't it? So it's less than 4 weeks now. I know, it's really not that far.
This year is flying by.
Certainly is.
It is so fast. But anyway, if you have enjoyed the show, if you're listening to the podcast, then obviously please subscribe to our YouTube channel. That really helps us reach more people on Google, because obviously they're owned by the same people. And take a few moments just to leave a rating and review on the podcast app. Also, so I don't forget, listen out for the Celebrate 𝐒𝐻𝐀 podcast as well, which Michelle, I haven't thanked you enough for having me as a guest on the show. I don't know what caused you to do that.
I got such good feedback from that chat. You really,
nice?
I think you dropped some knowledge bombs there. So lots of good feedback about that.
It was nice to be in the opposite seat for a while. But yeah, check out Celebrate 𝐒𝐻𝐀 podcast for loads more information on there. And check out the other, 5, 6, 7 episodes on here with either Siobhan O'Donovan, the Booby Physio, or Michelle Lyons of Celebrate 𝐒𝐻𝐀. There's loads of free CPD there. Stop sending me emails saying, I need some CPD. It's there, 250 hours of it for you for free. Plus, of course, all the courses and things. Siobhan, what have you got on? Just to mention courses at the end. What have you got running at the moment or coming up, which listeners might be interested in?
Yeah, so I run a workshop which is called Gals Against Gravity, which is basically just to kind of raise awareness about the concept of breast weight as an issue for women and girls of all breast sizes. And that's also really important, that it's not just a larger breasted issues. All of these consequences of poorly supported breast weight will happen to people regardless of their size. So my introductory workshop is very much about raising that awareness, but also I can't be doing with awareness without some level of action. So it's about knowing then what you do with that awareness and how you can then signpost people. And then following that, if it's a situation that kind of is appropriate for people in terms of their clinics and so on, I then have the next level of training, which is to offer posture fitting as a service. So that's where we can offer it, the actual service where we're looking at somebody's posture, looking at their bra fitting, and then combining the two so that they're getting internal support as well as external support. So they go from dipped headlights to high beam, and can sustain the high beam, because that's also, a situation that isn't sustainable if it's one thing or the other. So that's kind of the two trainings that I do. But the Gals Against Gravity is kind of something that I do over the year when I've got enough people who want to do it. I have a waiting list of about 50, but I'm quite happy to kind of just roll it as people want it. So
that's great. And full details at posturefittingphysio.com. Not just for physios, is there kind of an entrance?
Oh, for everybody, anybody who works with women and girls, and or anybody who just is interested in it. It doesn't, it's very much it's very narrative. It's not a deep anatomical course at all. It's very much looking at the research, looking at the evidence, and just really looking at the sequelae. So yeah.
Fantastic. We'll make sure details for all of that go into the show links. But posturefittingphysio.com. Have a little look and you'll see details of that. And then Michelle Lyons, what have you got going on or coming up?
Yeah, well, after the giddy heights of the STA conference, I'll be heading to PelviCon in Atlanta, and then I'll be going up to the POGP conference in Edinburgh. And where else will I be? I have a few other things coming along, but generally, if you follow my Instagram, I spill all the gory details there. So it's Michelle Lyons _Muley-Eberty, and the links to all my online courses, all of everything about women's health that I'm involved in is on Instagram. So that's the place to track me down.
It's true. And it's well worth following it for loads of great information.
Oh, thanks.
Yeah. And for you, Siobhan, where's the best place? Via the website, or is there a social media feed which you tend to favour?
Yeah, I keep meaning to change my name on social media to the Booby Physio, but I haven't done that yet. So I'm posture fitting on Instagram and Facebook and all those kind of places. I've got a couple of talks that I'm giving that are coming up, one in Cork. And Michelle, I just want to say we have renamed Edinburgh. It's now Edinburgh.
Oh, look at that.
I see what you did there.
That's how they pronounce it. That's how the Scottish pronounce it. They'll say Edinburgh.
There you go.
It is.
That's very good.
Oh.
I've been dying to use that special effect, and you just gave me the best.
I just set that right up for you, didn't I?
You certainly did. It wasn't even planned. Amazing. Thank you so much, you two. Really appreciate it. And a wealth of information. I can't wait for people to listen to this, the podcast. Thank you as well, everybody who joined us live. Really appreciate you guys joining live and asking questions and showing your support. If you are interested in joining live, then all you got to do is come along to the Sports Therapy Association YouTube channel or Facebook, normally on a Tuesday. But remember that next week, it's actually Wednesday. So join me if you can on Wednesday, the September the 3rd at 8 o'clock, still 8 o'clock on a Wednesday. And I'll be joined by Dr. Claire Minshall, a rehab and conditioning specialist and founder of Get Back to Sport, and Serena Simmons, who's chartered psychologist and founder of the Psychology School, who a lot of you might not have heard of fully, but she's really starting to put out some amazing information on Instagram. So check out the Psychology School in preparation for that if you're coming along for the live show. Some really great information coming out with regards to behavior and coaching and everything, all the little hidden skills which we think we've got, but we don't actually really have, which can make us an even better therapist. So check that out. Right, we're done. Thank you so much, Michelle, Siobhan.
See you in Exmouth.
Yeah. Oh, that sounded so strange. How wonderful. I can't wait. Right. Amazing. Thanks so much. And
Thank you.
we'll see you soon. Take care, everyone.
Take care.
Bye.
Bye bye.